Hello everyone. We have in our midst today Brial Colaco, a young Margao-based physiotherapist. She has her own clinic called The Physio, and it is located very near the popular Chinese restaurant Galen. Brial Colaco has graduated from Father Muller's Medical College in Mangalore and proceeded to get a postgraduate degree in Health Services Management from the University of Sheffield. Welcome, Brial Colaco. I'd like to ask you right at the start about the nature and scope of your work.
Okay, so physiotherapy involves restoring and rehabilitating people who are injured, but that's not limited to only that. It is pain relief and preventing injuries as well.
Okay.
And so a lot of people have a misconception about physiotherapy being more a massage or just exercises. But there's a lot more to physiotherapy than just massage and exercise.
Okay. In what way would you say that it is different from the work of a chiropractor?
So their basic aim is the same, to relieve pain, but chiropractors deal with alignment of the spine, and that is their main goal. But as a physiotherapist, we look at an overall body movement.
All right.
Rather than just alignment. So they deal with joint pains, back pains, neck pains, headaches. But for us, it is an overall body rehabilitation, muscle pains and all of that included.
Okay. And occupational therapist, is that different?
Yes. So occupational therapists, they work with more functional activities, the gross and fine movements, and rehabilitating you into functional things. And for us, it is more about strengthening. It is a part, occupational therapy is also part of
Physiotherapy?
It's not a part of physiotherapy. It is there is an overlap there.
Okay, okay. When it comes to working as a physiotherapist, do you instruct your patients or do you work with them to achieve set goals?
You have to work with them. Instruction, yes, at some point you have to instruct, but when you work with them, achievement of goals is better, motivation is more. So if you have to do an exercise, you should be able to do it. You don't expect the patient to do the exercise if you cannot do it. So when you work with the patient, there is more response.
Okay, okay. Are there different techniques of treatment? Can you enlighten us on that?
Yes, so physiotherapy has a wide variety of treatments. We have manual therapy, which is a hands-on, like a trigger point release. You have stretching, strengthening, it's all under manual therapy. We have kinesiotaping, use of special tapes to prevent injury, protect any injuries. There's new things coming up. There is dry needling, similar to acupuncture, but these are fine needles that are inserted into trigger points. It relieves pain.
Okay.
There is cupping therapy as well. So cupping therapy, they use suction cups to help relax the muscles.
All right. What would you say are the qualities required for a good physiotherapist?
First and foremost, you have to listen.
Yes.
Because a lot of people come with psychological pain. So when you listen, half their burden is relieved there. So you find that a lot of people talk about issues. So if you don't listen, you cut them off, then it becomes difficult to rehabilitate. So you listen first, and then you talk about their issues. They are physical issues, but there are other issues also sort out when they talk to you. A lot of burden is relieved. A lot of pain that we have is psychological as well. So listening is one.
Yes.
Then you have to have your knowledge, up-to-date knowledge, very important, because now with the internet, a lot of people are also reading up. So if you're not aware, then it becomes difficult because your patient is teaching you then.
Yeah.
Yeah, so that is one. Then you have to be very adaptable, meaning if you're trying to teach somebody something at that point they have a difficulty, you know that it is required, so you have to be able to adapt to that situation quickly. So assess and diagnose immediately, so you can change.
Yeah.
Also, when you set your goals, they have to be very realistic. You can't say at the end of the day, I want you to have like a 90-degree range of motion when you know it is not possible. So you say, okay, 10 degrees today and say another 10 degrees the next day. So when you set realistic goals, it becomes easier for the patient. You have to be very motivating, gain their trust, and then it becomes easier to treat. So the few qualities that are required as a physiotherapist.
Yes. May I ask you, what drew you to this field of physiotherapy?
Yeah, so I always wanted to be in the medical field, and after 12th standard, that's your deciding stage. So I had my options. Medicine was out of question because for me it was too much of study. Not that physiotherapy is any less, but it has a different kind of satisfaction when you can get your patient from being bedridden to walking normally. So that was what actually drew me to the profession. I wanted to be in that role. At the end of the day, you come home feeling that you have played a role in bringing somebody back to their feet. So you have that satisfaction, and that is what drew me to the field.
Yeah, that's wonderful. Would you like to tell us a few experiences you might have had as a physiotherapist? Anything memorable?
Well, there are a lot of cases that we have seen. The best is when bedridden patients get back to walking. Stroke patients, you know what a stroke is. You're paralyzed on one side. So when these patients actually get their movements back, that is what. There was one brain injury from an accident. He was bedridden about 2 years ago, and he's walking, not normal, but he can walk.
Yes.
Which is brilliant, I think.
Yes, of course.
Yeah, we have other cases as well in the past. Children, babies with wry neck, the twisted necks.
Yes.
They have also recovered. Children with curved spines, they have also recovered. These are few memorable cases that I have.
Tell us about the course, the physiotherapy degree course.
It is a 4.5-year course with a 6 months internship.
All right.
We study the first year is basic anatomy, physiology, exercise. The second year is more physiotherapy based. Your third year is more medical based.
Okay.
And your final year is all your treatment based.
All right.
So your 4 years, and then 6 months you do in every department. Your medicine, surgery, pediatrics, orthopedics, neurology. So you have 1 month in every department.
I see.
So you have experience before you pass out in all the fields. And then when you want to do your masters, you know what you want to do. You could break after your physiotherapy or bachelor's and practice, and then go in for masters once you know what you want to do. So
So there are specializations in physiotherapy then?
Definitely.
In the postgraduate
just
field?
like we have in medicine, we have in physiotherapy. Because rehabilitation you do in every field. When you have a orthopedic issue, you go in for orthopedic physiotherapy.
Yeah.
You could have a neurological issue, neurological physiotherapy. We have women's physiotherapy. We have pediatric physiotherapy, community-based physiotherapy. And now there are a lot of courses abroad as well that have more divisions, specializing in movement science, sports physiotherapy, kinesiology.
Okay. Are there any diploma courses in physiotherapy?
There are colleges providing diploma, but it is more widespread abroad. So the entire course is divided into diploma, and at the end of the 4 years you get your degree. So if you finish, if you want to stop, you could stop at 2 years with your diploma, and you complete post your diploma, you get your degree certificate.
Okay, okay.
But then what happens is, when you have just a diploma, you can't really work as a full-fledged physiotherapist. Abroad, they have different levels where you work as an assistant to the physiotherapist, and you can work at a certain level depending on your qualification. But in India, it is different.
Okay.
We don't have assistant to physio. Everybody wants to be just the physiotherapist.
Physiotherapist, I see. So you graduate, then there is a postgraduate course, and is there a doctorate, a PhD?
There is always
There is.
further study.
Yes.
They have PhD. You can specialize, if you have specialized in your orthopedics, say for example, you can go in for your postgraduate as well.
Okay. I think you've given us quite a lot of information, and thank you for enlightening us, Brial. And is there some message that you would like to give our viewers?
Yes. So again, physiotherapy is not only for those who are injured. It is for everyone who wants to have a healthy body. So your health is your wealth. So take care of your body and be healthy.
Thank you very much. That was Brial Colaco, a physiotherapist from Margao, who has just enlightened us on the field of physiotherapy.